Tuberculosis, an ancient disease. Just how much do you know about it? Where does it come from? I'm Sadie Udy. Let's take a look at the etiology of tuberculosis. The causing agent of tuberculosis is a long rod-shaped bacillus called Mycobacterium tuberculosis. It has a unique cell wall with many lipid layers, creating a waxy coating. This makes it impervious to the gram stain. Because it's so hard to use this test, an acid-fast stain test is performed to pinpoint the bacteria. This bacteria ranges in length between 2 and 4 micrometers and a width between 0.2 and 0.5 micrometers. Because you can see there are no appendages, flagella, pili, anything like that, it is non-motile. This bacteria generates very slowly, 15 to 20 hours to develop and 6 weeks to colonize. This bacteria multiplies end on end, creating a cording effect. You can see at the picture to the side how the bacteria does really look like a rope or a cord, and if you were to look very closely in a microscope, you would see each individual bacilli stacked end on end.
Hello, my name is Justin Borges, and I will be talking today about the reservoir and the signs and symptoms of tuberculosis. We're going to talk a little bit about, how modern medicine has been able to help prevent this disease, and we'll see that the countries who don't have the ability and the knowledge of the medicine, as well as we're going to talk about some signs and symptoms that will help protect you and your family.
So the human host serves as the only natural reservoir for Mycobacterium tuberculosis. The ability of the organism to efficiently establish latent infection has enabled it to spread to nearly 1/3 of the world's population. According to the 2014 World Health Organization report, an estimated 9 million people have developed tuberculosis and 1.5 million people died. And we can take a look here how modernized medicine has been able to really prevent the spread of tuberculosis, especially if you take a look at North America, Eastern Europe, and Australia. We can see how the medicines and the advancements and the availability of medicine has been able to help the spread of that. If we were to look over in Asia, we can see how there's more heavily densely populated people, and per capita, we can really see how one person getting sick, how it can really spread to another. If we take a look at Africa, where they're poor in medicine supplies and everything that goes on over there, we can really see how the spread and how fast it can really spread to one person to another. Signs and symptoms. Symptoms of tuberculosis disease depend on where in the body the TB bacteria are growing. The TB bacteria usually grow in the lungs, and the TB bacteria can live in the body without making you sick. This is called latent TB infection. And most people who breathe in TB bacteria become infected. The body is able to fight the bacteria to stop them from growing. People with latent TB infection do not feel sick, do not have any symptoms, and cannot spread the TB bacteria to others. If the TB bacteria becomes active in the body and multiplies, the person will go from latent TB infection to being sick with TB disease. And people with TB disease usually have symptoms and may spread TB bacteria to others. The tuberculosis bacteria most commonly grow in the lungs and can have symptoms such as a bad cough that lasts 3 weeks or longer, a pain in the chest, or coughing up blood and mucus from deep inside the lungs. Other symptoms of TB disease may include weakness or fatigue, weight loss, no appetite, chills, fever, and sweating at night. And taking a look here, looking at the photo on the right, I really like this one here because we can really see the main symptoms of the pulmonary tuberculosis. And we can see how it affects your lungs, but it also affects other aspects of your life, especially in your central nervous system, where this affects your appetite loss and your fatigue. And then we can also see that in your skin, you'll develop some night sweats and some pallor. And in your lungs, that's where the pain and the coughing up the blood comes, and productive prolonged cough. So thinking of this here and trying to assume what it would be like to have this, I would imagine it would be much like having a sinus infection. And when you cough and you do that deep cough to cough up those mucus that's in your lungs, there's always that deep feeling of pain that's in that chest. And I would imagine someone having tuberculosis would have similar pain, but to a much more extent. And so this is why it's really important to get to the doctor and get that treatment to start fighting this disease.
Hello, I'm Natalie Williams, and today as part of our tuberculosis presentation, I will be talking to you today about the transmission and treatment of tuberculosis. TB is an airborne particle. The infections are generated when people who have pulmonary or laryngeal TB disease cough, sneeze, sing, or shout. Depending on the environment, these tiny particles can remain suspended in the air for several hours. TB is transmitted through the air and not by surface contact. Transmission occurs when a person inhales droplet nuclei containing TB and the droplet traverse the mouth or the nasal passages, upper respiratory tract, and bronchi to reach the alveoli of the lungs. As you can see with the picture on the bottom, just one cough or sneeze with someone who is affected with the bacteria can affect a wide range of people around them, especially considering the fact that bacteria stays in the air for several hours. Even if the person who has TB is gone, the bacteria is still in the air and affects everyone around the area. This bacteria affects people of all ages. However, it is more severe and worse for infants and the elderly. This is why you are checked to see if you have TB before you work at a hospital or nursing home, because it can spread so quickly from one person to another just by talking to them. And you are already working with sick people, and if they get infected with TB, it can be even more threatening. I remember before going to BYU, Idaho, I was asked in a survey if I had TB or have ever had TB. This is because it spreads so quickly that they don't want the population of BYU, Idaho to have TB. Treatment of TB depends on whether the patient has latent TB or active TB. If it is active TB, your medication will be more extreme. It is important for those with TB to stick to their medication treatment so that after a while they will not become contagious. TB can be treated by taking several drugs, usually for 6 to 9 months at a time. It is very important to finish this medication and take the drugs exactly as prescribed by your doctor. If you stop taking the drugs too soon, you could become sick again, and if you do not take the drugs correctly, the germs that are still alive may become resistant to those drugs. As you can see in the picture, there is a lot of medication you have to take when you get infected by tuberculosis. Some patients get feeling better and are tired of taking their medication, so they will stop taking it altogether. This is really bad because they are not fully healed and are still contagious and will spread it to those around them. This is why when treating patients with TB, it is important that they are aware that they need to be sure that they are taking all of their medication so they do not become more sick and even more contagious to the people around them, and so that they will not become resistant to the drugs that they are taking so that they will be able to be healed altogether. It can take 14,600 pills to treat one person with drug-resistant TB. If you stack up the number of pills end to end, that is equivalent to the height of the Golden Gate Bridge. Drug resistance arises due to improper use of antibiotics and chemotherapy of drug-susceptible TB patients. This improper use is a result of a number of actions, including administration of improper treatment regimens and failure to ensure that patients complete the whole course of treatment. Essentially, drug resistance arises in areas with weak TB control programs, and a patient who develops active disease with a drug-resistant TB strain can transmit this form of TB to other individuals.
So it is really important to know the steps that are needed and what you can do to help prevent the spread of TB disease. And it's not too hard, it's not rocket science or anything, it's actually pretty simple. Proper cough etiquette and respiratory hygiene means covering your nose and mouth when coughing or sneezing. This can be done with a tissue, or if the person doesn't have a tissue, they can cough or sneeze in their upper sleeve or elbow. But they should not cough in their hand or sneeze into their hand. Yeah, I'm sure we've all been told by our mother at one point in our lives to cover our mouth when we sneeze and when we cough. Simple steps just by covering our mouth is an effective way to help prevent and control the spread of this disease.
Tuberculosis is really an ancient disease and has been around for 20,000 years. Archaeologists have found Mycobacterium tuberculosis inside relics and mummies of Egypt. Shown at the left is a mummy of an infant. They opened up the lung cavities of this infant and found Mycobacterium inside. So we can see that Mycobacterium tuberculosis has been around for a very, very long time. This wasn't always called tuberculosis. 18th century tuberculosis spread rapidly because of close living quarters and was called consumption because people lost so much weight and the disease consumed them. You can tell from the picture below why it was called consumption. And an interesting note, if you've ever done indexing work for family history and looked at the death records or death certificates during the 18th century, you would see a lot of the causes of death, what they've written in there is consumption. Other names for tuberculosis have been the White Plague, the Robber of Youth, the Captain of all these men of death, the Graveyard Cough, and the King's Evil. Isolation was a big thing when it came to the prevention of tuberculosis. People that had tuberculosis were put in sanatoriums so they would be isolated from society, and these are also known as waiting rooms for death. You can see at this particular sanatorium they are placed in an outdoor setting with their beds in the back and their lounges in the front. Perhaps the outdoor climate helped with their breathing. If you'd like to know some famous people to have had tuberculosis, think of OK Corral gunman Doc Holliday. You know him. He was the sidekick to Wyatt, Virgil, and Morgan Earp when they came in close contact with the cowboys at the OK Corral. An interesting note, before Doc Holliday was a gunman, he was actually a dentist. I wonder if he could have contracted tuberculosis leaning over a patient who did have tuberculosis at that time. Another famous person to have had this disease was the author Edgar Allan Poe.